South Africa faces a complex health landscape shaped by persistent inequality, a growing burden of chronic disease, and uneven access to healthcare services, particularly within underserved and rural communities. In this context, many individuals are increasingly seeking complementary health approaches that are affordable, culturally acceptable, and oriented towards prevention and long-term well-being alongside conventional medical care. Guided by the regulatory framework of the Allied Health Professions Council of South Africa, the Chinese Medicine and Acupuncture Association of Africa, CMAAA, actively fulfills its responsibility to promote health and contribute to public well-being. Under the leadership of its president, Professor Zijing Hu, CMAAA has played a central role in advancing the responsible development of traditional Chinese medicine, not only in South Africa but also across the region, with impact extending to countries such as Lesotho, Angola, and Gabon. Within South Africa, the University of Johannesburg currently stands as the sole public higher education institution offering formal professional education in traditional Chinese medicine, with a particular focus on acupuncture. Training pathways span undergraduate, postgraduate, and doctoral levels, ensuring academic rigor, clinical competency, and regulatory compliance. The CMAAA logo symbolizes this vision, representing the integration of Chinese medicine and acupuncture within the African context. Complementing this formal education, CMAAA regularly delivers public lectures at universities across the country to promote awareness and understanding of traditional Chinese medicine within the academic and health communities. Beyond clinical practice, CMAAA is committed to strengthening professional capacity through continuous professional development programs offered on a regular basis. These initiatives support practitioners in maintaining and advancing clinical competence, ethical practice, and patient safety. In parallel, CMAAA is actively engaged in voluntary community outreach, including free health screenings and treatment services, contributing to community-based healthcare and public health promotion. At the policy and governance level, Professor Hu has been directly involved in national initiatives aimed at integrating traditional Chinese medicine into South Africa's evolving health system. This includes participation in a task team led by the Registrar, Mrs. Esther Pillay Naidu, in support of the inclusion of traditional Chinese medicine within the National Health Insurance Framework. Professor Hu has also contributed to the National Board Examinations for Chinese Medicine and Acupuncture, upholding quality assurance and professional standards. Since 2022, he has led the development of national guidelines for board examinations and competency assessments. In addition, he has been invited to offer expert input to the World Health Organization's benchmarks for training and clinical practice in traditional Chinese medicine. CMAAA's efforts have also received international recognition. The association has been acknowledged by the Chinese government for its contribution to integrating traditional Chinese medicine in South Africa, with demonstrated support from the Embassy of China as well as provincial leaders and partners in Fujian and Sichuan. CMAAA further promotes evidence-informed practice through academic publishing, including the journals Complementary Medicine, Education and Research, and Bilingual Chinese Medicine in Africa, supporting scholarly dialogue and knowledge dissemination. Research and evidence generation form a critical foundation for the responsible integration of traditional medicine. Digital platforms are increasingly used to expand access to education, professional exchange, and training while maintaining quality and oversight. Collectively, this work contributes to broader South-to-South cooperation in health, fostering sustained dialogue between African and Chinese institutions in education, research, and policy development. The South African experience closely aligns with the World Health Organization's strategic priorities for traditional medicine, particularly in the areas of regulation, workforce development, and health system integration. As health systems worldwide seek more inclusive, people-centered, and sustainable models of care, traditional medicine, when responsibly governed and evidence-informed, has the potential to make a meaningful contribution. The South African experience demonstrates how traditional knowledge can be integrated into modern health systems in ways that promote equity, safety, and human-centered care.